Welcome to this edition of Community Health Matters. I'm your host, Kelly Davis. On this edition of Community Health Matters, we will be exploring behavioral health services and treatment offered by Vista Community Clinic. Our first guest on today's show is Cara Walstein, Behavioral Health Manager at Vista Community Clinic. Hi, Cara, and thank you for joining us.
Thank you for inviting me.
So what is your role at VCC? What you do there?
I manage a very busy behavioral health department, and we work with the people who are referred to us by their primary care providers, and we do a lot of screening and assessment, and we do ongoing therapy. We have psychotherapy, we have licensed clinical social workers, and then we have physicians, of course. We have an alcohol and drug counselor, and a care coordinator. We have a lot of people involved in helping patients get their behavioral health needs met.
And I understand that Vista Community Clinic has a new program. I guess, is it in the Behavioral Health Service Department? What is that?
It is in our department. It's a brand new program. We're really excited about it. It just rolled out in January. So what we're doing is we're helping people with opioid use disorder who are coming in. They're either on painkillers, they're on maybe illegal drugs like heroin, or they're having a lot of chronic pain issues and they want to get off the dependency of these opioids. And so there's this new wonder drug called Suboxone, which is, there's some big words here, but it's buprenorphine and naloxone that creates Suboxone, which we use as a medication-assisted treatment to help people get off of those drugs so that they can start living more normal lives.
If they take this wonderful drug you're offering, is it a cure or is it manages?
It's a maintenance program. We start with an induction. They come into the office. They get referred to us by their primary care provider, which we call PCP, and it's not the drug, it's the physician. And they come in and we do an assessment and we screen them to see what their needs are, and then we get them the help that they need. We've got these really big cozy chairs they get to sit in when they have an induction, and we want to see how the medication's going to take in their body because it's different for everybody. You know, if they're already on a methadone program, we want them to be down to about 30 milligrams for at least a week before they start with us. They are going to be in a little bit of precipitated withdrawal when they come to us because we don't want to have them on anything else when we're giving them the induction with the Suboxone. So if they're taking anything like benzodiazepines, they would not be appropriate for us because what they have to do is get off everything, including alcohol.
Is this an inpatient or outpatient
We are an
treatment?
outpatient doctor's office. So from the outside, you'd never know that we're doing treatment in there because it's where you go for your doctor.
Your clients, they have to come into your facility and then go home and hopefully kind of adhere to the program?
They do. They have. There's a lot of rules, of course. I mean, they have to come back often and come to an educational support group where they can be with other people who are going through this as well. They can have individual therapy with our alcohol and drug counselor or a licensed clinical social worker, and even meet with our psychiatrist. So we've kind of got this wonderful full scope of help for them.
It sounds awesome. And
it is.
And how does, if there's someone watching, for example, that might have an opioid use problem or condition, how can they get started with your...
They get started by coming to see one of our primary care providers, the PCP, what we mentioned before, and having that general physical exam. Then that physician would refer to the MAT program, which is the medication-assisted treatment. There we will start doing an assessment and see, you know, are they ready to give up this stuff, you know, because we're finding out that there's actually a decreased mortality rate of 50% for people getting off those street drugs, or maybe they're taking too much of their prescription drug and they're finding that they're having cravings and they have withdrawal if they're not on it, so they get this dependency going, and we can help interrupt that. We can help them get back into life, get to work, go to school, have better relationships, and it's really amazing.
When they come to the program, and I know you just started, do you know, how can you judge about how successful it has been so far?
It's been very successful. All over the country. We're not new to this, we just are in this area. But I've been to a lot of trainings and conferences, and it's just awesome what's happening with people. They are getting off drugs. We're lowering the rates of HIV and hepatitis C, with needle exchange. This is kind of what we would call a harm reduction technique, although, abstinence is ideal, but you can't help a dead drug addict, right? We have to help them where they're at and what they're ready for. And so this is where a lot of people are ready to look into it and say, well, what can we do here?
So you mentioned PCP, primary care provider, but you also have a primary care setting. What is that, and how does it relate to behavioral health concerns?
Well, it's a great way to be seen. A lot of times people are afraid to go to a mental health clinic because then they think, oh, I'm crazy or something. And here you're going to just see your regular doc. And basically we can look and we can screen, and we have a better way of identifying that, oh, someone has depression or someone has a lot of anxiety or trauma that needs to be dealt with. And so we have greater access. It's more convenient for the patient to go to their regular doctor's office. There's not that stigma attached to it. Even the methadone clinics, they're appropriate for a lot of people. We like to see them come in where they don't have to do that morning dosage every time. They can just come into the doctor's office, and they can even have inductions at home. And then they'll come in for group, have their pills counted. They may need a drug test to make sure that they're adhering to the program.
Are there any other programs that VCC offers for someone who wants to get off of narcotics?
We do. We have an alcohol and drug counselor that will meet with them. They can do phone consultations. You can see them in person. He'll be doing groups every week with a lot of wonderful curriculum to help people with mindfulness training, teach them how to live without these debilitating drugs that are controlling their lives.
And what do patients need to do in order to get enrolled in your medicated assisted?
Medication assisted treatment, we call it MAT. Now you know why, MAT, M-A-T, MAT program.
So how can someone they're like, how do I get involved with that?
How do they learn about it? They can tell their doctor if they're a VCC, Vista Community Clinic patient already. They'll just say, hey, I'd like to meet with someone in the MAT program. And then they'll be referred to one of our, we call it data waivered physicians, who have been trained in inductions and are able to prescribe the Suboxone. They're very well trained in it. We have several physicians that are already up and running with this. They've been doing a lot of inductions already.
Okay. So if they go to their primary care physician, if it's outside of VCC, do they have to be a VC?
They do, because we want to have that continuum of care and that full scope picture of that patient so that we can provide everything that they're going to need.
So they do have to come to you.
They do. They have to come to us. Sorry, we're not doing home visits yet.
But is that something in the future, the home visits?
Definitely it could be, because we just started our telepsychiatry program as well, where the patient can come into the office and see a psychiatrist that's available to them in Orange County.
Isn't that something? So they come to and so it's kind of a, I don't know, Skype, telecom?
It is. It's just like you're looking at your TV screen having an interactive consultation.